Hi, it's Allison. Last time we touched on some signs that an individual may be having some memory issues. We talked about possibly they're repeating themselves, they're asking the same questions over again. Maybe you've noticed weight loss, or they're just not kept as well as they normally would be, their clothes, their hair, so forth. Maybe they have kind of lost the filter with things that they're saying, or maybe there's some behavior issues. So we hear the terms dementia and we hear the term Alzheimer's. So what is the difference? Well, consider, if you will, dementia to be like an umbrella, and it's over categories of symptoms. So there are literally hundreds of types of dementia, but a few that you're going to hear most about are vascular dementia, which is memory loss due to a stroke or probably multiple strokes. You're going to hear about frontal temporal dementia. Frontal dementia, the front part of our brains, which is sometimes referred to as the executive part of our brain, is where our decision making and our behavior stems from. So if you notice that an individual is having severe, difficulties making decisions, maybe the words again that are coming out of their mouth are not filtered like they normally would be, or there's some strange behavior, that is probably frontal dementia. Temporal dementia, the sides of our brain, is our language center. So maybe someone is having trouble finding the right words to say. They've always been articulate, they might have been a teacher, a professor, or something that they were very well educated, but now they just can't find the words. Or when you're talking to them, they can't understand what you're trying to say. Lewy body dementia is a lot like Parkinson's in its symptoms. So you may notice that an individual starts to shuffle their feet as they're walking. You may notice that their hands are trembling, and generally there will be hallucinations. So an individual may see their mom or dad who passed away years ago, or an animal or something that is very, very real to them, and that's not there. People with Lewy body dementia can one day be fine, you'd never know anything's wrong, and the next day their symptoms are present. So these are some, again, most of the common type of dementia you're going to hear about. So then what is Alzheimer's? Well, Alzheimer's is actually a disease of the brain. It is a disease where nerve cells are being killed, and so it affects the memory to the point where an individual will start, maybe gradually you'll notice some of these symptoms, but they will end up not being able to feed themselves. They won't know what a fork is, what a spoon is, how to do that. They won't know how to dress themselves. They might put clothes on backwards, or they will have to be directed in everything they do, and unfortunately bedbound, and lots of times they do die from it. So this also sounds so very bleak. And what can be done? Well, right now there is no cure. However, Banner Alzheimer's Institute and many other facilities are working around the clock trying to find a cure. There are medications that can be taken that will slow down the symptoms. And right now, those are being effective with people. There are also supplements that an individual can take along with this medication to slow down these processes. So again, if you notice any of these signs and symptoms, contact your doctor, have an examination, and we'll be talking about how do we interact with people who have dementia or Alzheimer's. Thank you.